Hello everyone, my name is Rafiat. I'm a registered nurse of almost 2 years now. My capstone topic is the effectiveness of intervention in pressure injury management. So this is actually what a pressure injury look like. There are also many different type of images, but this pressure injury can result if early interventions are not implemented right as the patient is admitted on the unit. And most of the time, pressure injury can actually be easily avoidable with the right implementations. A simple skin tear, a bruise, a patient having blanchable redness on the sacrum can result in a pressure injury as well. So many patients in the acute and critical setting have a very high chance of having pressure injuries. There are also multiple risk factors that I will later discuss in this presentation. Okay, I'll begin with my objectives. My objective for this presentation and my goal is to be able to explain the purpose of pressure injury interventions. I want my viewers to be able to know some implementation to reduce pressure injury. I will dive into the impact of pressure injury on patients' health. I will also discuss ways to educate nursing staff and patients on pressure injury prevention. This presentation will also include my rationale to pressure injury. Next is my background and significance. Next, I will include the PICO statements. Then I will also sum up my literature review. I will include my proposal plan, my pressure injury implementations, and I will also include a slide talking about dissemination. That is how I will educate others on pressure injury management. Okay, so we begin with rationale and purpose. So pressure injury, what is pressure injury? Pressure injury is damage to the skin and tissue. It is caused by prolonged pressure to the skin and bony areas such as the heels, the tailbone, the elbow, the sacrum, even the back of the head. A wide Pressure injury is a widespread problem in the healthcare setting. It actually interferes with the patient's quality of life. I see a lot of patients on my medical surgical units with pressure injury that actually just impact them mentally as well. Pressure injury reduces blood flow and causes tissue damage. Pressure injury can also be staged. We have stage 1 to 4. It can be unstageable. When a pressure injury is unstageable, that's when the depth and the wound damage cannot be assessed. And this type of wounds are black and the tissue are just necrotic. They are just dead. Complications can also result from pressure injuries. This put patient at risk of infection, delayed wound healing, extreme pain and discomfort. It impacts the mental health. Patients have a risk of amputation as well. For instance, sometimes I have patients with pressure injury on their heels that at times the solution is to have amputation due to lack of blood supply to that area. Pressure injury increase healthcare costs due to long-term nature of treatments. Okay, I'll talk about the background and significance of interventions. So risk factors for pressure injury includes immobility, critical illness, elderly patients who may be bedridden, incontinence of bowel and bladder, those who have malnutrition, um, which can be seen with those with advanced age and health conditions, those with chronic conditions such as diabetes, which is actually a common one. I do get a lot of patients who are diabetic and they eventually have pressure injuries due to lack of blood supplies. Those who are dementia are at risk of these issues. Those who are paralyzed and those with spinal cord injuries. Okay, significance of interventions include proper and effective health outcomes. Significant of pressure injury can also interfere in with quality of life, like I mentioned earlier, as well as the health cost. It also causes extended hospitalization, and it can be very overwhelming for patients and families, as well as any caregivers. Research and evidence-based practice have implemented prevention such as the use of specialized mattress, regular repositioning, and protocols are placed in some facilities. For instance, on my unit, we are required to turn patients every 2 hours if they are at risk of pressure injuries. And also, proper nutrition and management is very, very essential for pressure injury management. Okay, I'll talk about my PICO statement. So my PICO statement is in hospitalized patients in a critical settings, including patients who are elderly, immobile, and critically ill. Thus, implementing interventions such as regular repositioning and turning every 2 hours, use of equipment, utilizing Brady's scale, which is a skin assessment tool, applying moisture creams, using foam dressing, doing wound care, and use of pressure relieving device by the first day of being hospitalized, compared to implementing interventions later on in the patient's hospital stay. How does that reduce the risk of occurring wounds? Okay, talking about my literature review next. So a lot of the research and information that I found was from nursing journals. I also include the interview that I did with a wound care nurse on my facility in my facility. Yeah. So one of the statistics that I found is for the mean adverse effect of for the mean adverse effect of patients with pressure injuries, 22% higher have higher rate of readmission within 30 days. 57% have longer hospital stays, and 3 times have higher mortality. So this just shows that pressure injury is actually something that's very much an issue in the healthcare world. And it's something that I believe that a lot of nurses and all healthcare professionals need proper education and training on. So the wound care nurse that I actually interviewed emphasized the need of proper staff education and management of pressure injuries. She stated that pressure injury is easy to manage but needs proper education and training. She also said that proper training includes knowledge on knowing the right intervention for pressure injuries. Okay, I'll talk about my proposal plan. So my first intervention is skin assessment. In my unit, my facility, we are required to do a 4 eyes assessment during shift change, new admissions, when we transfer patients, when we get another transfer patient from another facility. So pretty much your 4 eyes is when the primary nurse and another nurse assess the new patient's skin thoroughly. We do a thorough skin assessment with another nurse, and we also had to document that. So a thorough skin assessment with the other nurse include looking at the elbows, looking at the patient's sacrum, looking at their heels, underneath their abdominal fold, just to see if they have any skin issues or any pressure injury, because if they do have any pressure injury, we also want to take that before it gets to a stage where it's very, very hard to deal with. So the next step is using braiding scale. A braiding scale is a tool that is used word I'm sorry, not worldwide. A rating scale is a tool that's commonly used in my facility. It's actually part of our assessment on the EPIC charting. Um, it's used to assess a patient's risk of developing pressure ulcer. It's it is a evidence-based scale also for preventive measures, and the scale ranges from, I believe, 0 to 22. Um, in my facility, if a patient Brady scale is below 18, we had to make sure we implement some pressure injury preventive measures, such as repositioning them every 2 hours, doing skin assessment every shift change. What else? Yeah, that's pretty much it. Also using a Mepilis, which is foam dressing to prevent them from having worsening in their wounds. Lastly is education. I believe that patient and caregivers also need to be aware of factors that contribute to pressure injuries. Education also needs to include early signs of breakdown. Okay, I'll talk about my implementations next. Okay, so my implementation, so I will actually so this is a Mepilis for the heels. So basically it's just placed on the heel like this. Imagine the foot in here, and then this is the Mepilis. So I really think it's very nice. The Mepilis, it protects the ankle, the bottom of the foot, and just, the whole foot in general. And we give it to patients who have low mobility. That way their leg is not causing friction on the bed. And also it is dated. We always have our initial on it, and then the date that we placed it. And we also make sure we change this Mepilis every 3 days. So it's very nice. And then I have another one. It's also another Mepilis for when patients have very small skin tear or scab. We just placed it, we label it, we put the date, we put our initial. And then this one is for the sacrum. This Mepilis is for the sacrum. Usually just goes, just placed it on the buttock. So we have my initial and the date as well. And also this is how it is placed. And also at times, for instance, this one has instruction on how to place it. So we just take this off. And then imagine that this is the patient's heels is in there. Put the heel right here, and then we just close it. So we just close it like this. And just make sure you peel all of the wrap, and then go like this. So this is how it is. Just imagine the foot is in here, and it is very much well protected. And then it's very nice. Same as the buttock one, the one for the sacrum. We just peel it, put it on the bottom on the patient's sacrum. And then this one, same thing. We peel it and then put it on the patient's wound. And these things are very nice because it's just very effective. It's a common wound prevention interventions that we actually utilize in my unit. And then another one is called a triad cream. This is a triad cream. It's just come in a white paste, and it's a topical medication. It also helps relieve skin inflammation, itching, irritation, and one just needs to apply a very thin layer to the wound area about 1 to 2 times in a day or after any bowel movements, or yeah, just to any bowel movements. And also this thing, one can get it on Amazon. They're very, very, very nice. I definitely would recommend this for any patients or anyone that has high risk of pressure injuries. Okay. Another intervention is a waffle boot. It is something, it's a specialized footwear that helps those who have very limited mobility. It helps them prevent friction on their heels and just friction on the bed. And then another intervention is nutrition and hydration. Nurses also need to check medical device. For instance, a patient with a nasal cannula can also have pressure injuries, when they've been laying there for so long. Another one is to elevate the heels. Elevating the patient heels can also lower the risk of pressure injuries. Okay. My next one is evaluation. Okay, so evaluation is my expected outcome for the implementation is to have reduced pressure injuries in healthcare settings, to also improve patients' quality of life, to also have nursing staff having adequate understanding of skin assessment. Next is my dissemination. Okay, so with this capstone topic, my plan is to collaborate with wound care nurse. My wound care nurse, Michelle Robertson. We can just collab with her. She could just educate nursing staffs on ways to reduce pressure injuries from the second a patient is admitted. Further education is very important. We also can do a skin prevalence studies. A skin prevalence study can be done every 2 to 3 months. On my units, what we do with skin prevalence study is we have some nursing staff, usually the registered nurse and a patient care technician. They come together maybe once in a month and they go to each patient room. Those patients that have high risk of pressure injury, they just do a skin assessment. After getting consent, they do a skin assessment. If a patient has wound, they educate the patient on ways to prevent their wound getting worse over time. And also, just common education such as the Mepilis use, the triad, and also elevating their heels. Okay, so to summarize the presentation, implementing pressure injury interventions the moment a patient is admitted is important for reduction in pressure injuries. The wound care nurse that I actually interviewed, Michelle Robertson, she also emphasized the importance of nurses receiving adequate teaching and training on pressure injury. She do believe that at time pressure injury, it's that one that one thing in healthcare that not a lot of nursing staff have adequate teaching and education on. And she did emphasize that maybe the nursing managements can, they can create some online classes or in-person training on ways to implement some interventions on reducing pressure injuries. The goal is to reduce hospital stays. We also want to enhance patient outcomes and reduce unnecessary treatments for our patients. And that's pretty much sum up my capstone topic. I hope you all enjoyed learning about pressure injury. And we want to say no to pressure